Hello everyone, welcome to US Residency Training and Beyond. I'm Dr. Viswanath, Aluru, attending physician in physical medicine rehabilitation at Optional Health in New Orleans. In this video, we will continue with our topic patient care. In the last video, I was talking to you all about taking care of a rapid response at a cold situation. The rapid response happens whenever there is an acute change in the status of a patient. It might be a syncopal episode, it might be acute onset of weakness, it might be respiratory distress, or it might be chest pain, it might be acute onset of severe pain, whatever situation might be. Then there will be like an overhead page or overhead announcement to grab the attention of everyone on the floor, to make sure everyone go see the patient and take care of the situation as soon as possible, as quickly as possible. So you definitely have to leave everything behind and go see the patient, evaluate the patient at the bedside, check the vitals, blood pressure, heart rate, respiratory rate, make sure that airway, breathing, circulation are all normal, make sure the patient is alert, open eyes, respond to stimulation, verbal pain stimulation, answer your questions, all those things. And then see what was the reason for this rapid response, what was the underlying diagnosis, what medication the patient received, what might have happened. If you are able to take care of the situation on the floor, then I think you don't have to consider transferring the patient out of your service. But say if the situation is something that you cannot handle on your floor, then in that situation you have to decide, okay, whether you need to transfer the patient to the emergency department or consult other medicine or ICU service to transfer the patient directly to their service. Okay, so but in some situations when you go see the patient, it started as a rapid response, but then the patient deteriorated very quickly and the patient became unresponsive, then that becomes a active cold status. Then you should start with the basic life support involving chest compressions, and then you have to involve the core team. If you are part of like an acute care setting like a big hospital, then there will be like a core team involving medicine resident or a surgery resident, anesthesia, ICU team, nursing, everyone. So who will come to the rescue of the patient, and they might intubate the patient on the floor and then immediately transfer the patient to the ICU. That becomes a core situation. That's why when you're starting your residency training, before starting your residency training, you all need to have your certification for basic life support, advanced cardiovascular life support, and if you're going to see pediatric patients, then you should have like a pediatric life support as well. As a surgery resident or anesthesia resident, you will also be required to do like an advanced trauma life support, maybe in the second year of residency, and you have to maintain all these licenses, active throughout your residency training, because it's very important that you know how to run these protocols, how to run the codes actively, and how to be the team leader and directing your people what to do and when to do those kind of things. And so these are the outcomes of a rapid response or a cold situation. Now, in the next topic, I want to discuss a little bit about managing, calls, messages. So, as an intern or even as a resident, senior resident or chief resident, you will be getting a lot of text messages, lot of phone calls, lot of messages in your inbox on the computer. So, you should be able to be thoroughly manage all these things on time, because sometimes because you also carry a pager, so you might be paged several times throughout the day, and sometimes it becomes so unmanageable. So I used to carry like a small pocket book in my coat pocket all the time, so because I make a note of all the numbers, phone numbers, the messages, so I get back to them appropriately. Sometimes the call or a pager might be related to like some simple order that a nurse required, or sometimes it might be related to a consult from other department. Sometimes it might be related to another admission coming into your service, or it might be related to a really sick patient on the floor, just as you mentioned, related to like a change of status or a rapid response or a cold situation, or it might be related to discharging a patient or seeing another patient in the clinic. Whatever it might be, you should make sure that you develop this habit of answering those calls, messages, pages in real time. Because if you don't do that in real time, if you say I'm going to get back to this later, that later becomes never. So that's why it's very important you take care of these things as much as possible in real time. But if you know something is not urgent, then you can get back to it later. But most of the times you need to know what this is about first, then you can act accordingly. Same thing with your inbox messages in your electronic medical record. There will be an inbox. You will be receiving a lot of messages. You have to thoroughly check these messages from time to time every day, because these messages might be related to any pending notes that you have to finish, any unsigned documents, any unsigned orders that you put in the computer, or it might be related to some corrections in the notes you already put assigned in the computer, or some errors in the notes that needs to be corrected on time. So all these things are, some might be messages from other departments or patient family members. So you have to sort through all these messages from time to time on a day-to-day basis. And also there might be, because your co-resident, senior resident, chief resident might create certain groups, like a chat groups, to just keep everyone up to date on the things going on in the service. So you have to keep checking these messages also from those chat groups to make sure that you're following whatever they want you to do, those kind of things. So that's regarding managing the pager. Remember, trust me, no one really likes to carry that pager around, because it keeps going off all the time, almost every 5 minutes. It becomes really, really annoying sometimes. But that's how it is in residency training. It's always super busy, but once you become more and more senior, you will get less and less calls. But as an intern, as a first year resident, second year resident, you will be getting calls more often. Next, we'll move on to the next most important topic, is consult service. So as an intern, or even as a junior resident, senior resident, you have to be on the consult service. But as an intern, most of the times all the consult related calls will go to the intern pager or intern phone, because intern is the main person who acts as like a bridge between other departments and the service that they're working with. And sometimes don't think that why I have to go see the patient, why I have to do this consult, because you're actually actively learning. So when someone consults you, you start with the information that you have. You think about the differential diagnosis. When you go see the patient, evaluate the patient, you come up with your assessment, you come up with your plan. So you are actually sharpening your diagnostic skills, your management skills. This is part of the residency training program. Okay, so it's the most important part of your residency training program. So usually, why there is a consult? So consult means it's like a expert opinion, right? To how to handle certain situation, how to handle certain medical condition. So you might be consulted by other departments in the hospital, or you might get a consult to see a patient in the emergency room, or you might get a consult to see a patient in an ICU, surgical ICU or neuro ICU or medical ICU. So these are the various situations. You might be consulted for a bedside procedure like an incision and drainage procedure, or like a peripheral, like a central line, or some other ultrasound procedure. If you're a rehab resident, you might be consulted to evaluate the patient for any acute management of the impairments, medical management, rehab management, and any need for inpatient rehab admission, those kind of things. Because especially if you're a rehab resident, you will be consulted to see a patient with a traumatic brain injury, or a traumatic spinal cord injury, or a stroke. So because they have to deal with so many changes acutely happening to them, and you have to evaluate them thoroughly, give them your recommendations. So that's how the consult service works. But the first thing that you need to do is you have to make sure there's actually a official consult order placed in the computer. That's the starting point, because you can't randomly go see the patient and bill for their service, because they are consulting you. That means they are consulting your attending physician of the service that you are working with. So the hospital is going to charge under the attending's name, attending's NPI number. That's why there should be like an official order before you go see the patient. Once you make sure you have the order, sometimes if it's like an emergency, you just have to go see the patient, and then deal with the rest of things later. That's most important thing. So In the next video, we will discuss in detail about the consult service. I hope you all like my videos. Thank you for watching. I will see you all again next time. Thank you. Bye.